Hello everyone, welcome to Rainbow TV. This is Renu. Today we have vascular specialist Dr. Shailesh Kumar with us. Let us talk to him and get more information regarding varicose veins. Hello sir, hi.
Hello,
Hi, how are you?
I'm fine.
Firstly, let us know what are varicose veins.
So, varicose veins are nothing but the tortuous, twisted, bulge veins in our leg. So, there are two types of veins in our leg. That is, one is superficial veins, which are just under the skin, and the other is the deep veins, which runs close to the bone and muscles deep inside your leg. So, varicose veins is a problem of this superficial veins just under the skin. That's the reason when they are abnormal, tortuous, and dilated, we can see them as tortuous, twisted just under the skin in the legs and thigh region. So these are very common problems. Especially we see these varicose veins in the profession of long standing, like teachers, bus conductors, or even in the operation theaters, like staff, hospital working staff, those who stand for long time. So apart from that, nowadays we are seeing even people who has a sedentary lifestyle, like those who sit for long time without any movements in the leg, or without the patient who goes for a break or walk, especially like IT professions also. When they sit in the computer doing work at a stretch for 3-4 hours without taking a break, we are finding them also having these varicose veins very commonly in recent time. So that is because when the muscles in the leg, they are called peripheral heart, because when you walk, these muscles, they pump the blood from leg back to the heart for purification. But when you stand at one place or sit without any movements in the leg, this muscle pump, they don't work, and that's the reason the blood get pulled in the leg and they stay there for a long time, and the blood which is staying there for a long time in these veins, that will distend this vein, and over a period of time, this doesn't happen in a day or a week. When you are doing that habit continuously for months and years together, these veins will swell up, and that's the reason we see these bulge veins in the legs.
Okay, so as we discussed, if they are present in the superficial layer of the skin, can we identify them easily?
Yeah. Most of the times, 90% of the times, just by looking at the legs only, your legs, when you examine or when you sit and look at your legs carefully, you will find them bluish, thin, or sometimes reddish color veins, especially in the fair skin people. These veins are as thin as hair-like. So those are called spider veins. That is the first stage of varicose veins. And as the disease progresses, as the stages increases, these veins, from their size of hair-like, they become finger-like or very thick and tortuous. So as this disease is categorized in 5 stages. Stage 1 to stage 5. Stage 1 is early one, as I said, spider veins or reticular veins, like the legs of the spider. So that's the reason they are called. That is the stage 1. And as the disease progresses, advanced stages is the stage 5. So stage 2 will be thicker veins. Stage 3, along with these veins, patients start experiencing the symptoms like pain, heaviness, swelling around the ankle region. When they go to work and come back in the evening, they find their ankles and lower part of the leg is swollen. And when they next day in the morning, when they wake up, they find that the swelling has disappeared, because they have taken the rest, and because of the gravity, when they are lying horizontally, and that swelling, because of the gravity level, it goes back into the circulation, and the swelling subsides. And again, when they stand in the next day morning, because of the gravity, the blood get pulled into the lower part of the leg around the ankle, and the swelling start. These are the different symptoms. And sometimes you even in the advanced stage, you find this discoloration. The color of the skin is changed. You will find dark spots, black spots, pigmentation kind of thing. And some patients experience itching also. Stage 3. Stage 4, some patients, because of this itching, they scratch and they find that small ulcer is there, and that wound or ulcer is not healing. And stage 5 is a large ulcer, chronic ulcer since many days and all. When you neglect this disease, since years together, and that is the stage 5.
Okay.
That
So,
larger stage.
in which stage people used to come to you, sir? Like,
See, there are two kinds of people. Those who are very health conscious, they come in the stage 1 only when they find this bluish vein, and some patients who are not very health conscious, they come in stage 5 when the wound is very large and not healing, or even after consulting many doctors, because they go to nearby doctors like RMPs and small doctors wherever, not specialized in the vascular, and they try to delay it, even though the doctor tells them that you go to a specific vascular surgeon or vascular specialist, but still, because they tolerate that pain, or sometimes they may not feel that pain, or the disease is since there since 10 to 20 years, they try to neglect it. This that I'm there, this disease is there since 20 years, it is not affecting me, so they try to neglect it and come in a very advanced stage when the wound has become so bad, smelling, or in complicated stage. So there are two different kind of group of people who like.
Like, can people diagnose at home like something is abnormal with their skin?
Yeah,
or...
definitely. See, this disease is not there since birth, or not there since when they are young. This disease is usually seen in the later half of our age, like 30s, 40s, and 50s, depending upon your job profession. If it's very tedious work, standing for long, like teachers, professors, when they have to stand for 1 hour in the class and all. Those, or police, whose job is there to stand there for 8 hours or whatever the duty time.
Right.
So those patients become early. It's very easy to find because those veins were not there previously, and now all of a sudden you are slowly trying to notice them, that these veins are swelling up, and the patient also experience pain, swelling in the leg, ankle swelling, which is subsiding after taking rest. Or some patients, they can have these varicose veins in one leg and the other leg is completely normal. So you can compare both legs, that something is wrong going on this vein, or they are finding these bulges vein. But 90% of the times you see these veins on or under your skin. So that is the way to find out these varicose veins. If you have any doubt, better to consult the specialist rather than delaying going to considering this as a skin problem because of the dark spots, or considering this as a leg problem, going to orthopedician and showing them, trying some painkillers to reduce the pain, or going to some neurologist considering these veins as a nurse. So they make a round, and at the end they delay in the treatment. That's the reason you find it very difficult to treat them. And even after treating, these wounds or ulcers, sometimes they become chronic. In medical terminology, we call it as chronic because long-standing wound. So even after the treatment, these wounds sometimes very difficult to go back to the normal stage.
Okay. So what are the ways to diagnose them?
So first is clinically, just you can, from the outside looking at the legs of the patients only, we can diagnose. Most simple test is the venous Doppler test, which we do even in the OPD level. But it should be done by a perfect physician or a radiologist, especially in the standing position. Because as I said, when you take rest at the night, this swelling subsides. So most of the times when you lie down and do the scanning, these veins may not be obvious or bulge, and you may get a false report saying that there is no veins. So you have to do it in the standing position, see these veins, because in the standing position only these veins will come out and become more obvious. So standing venous Doppler in our hospital also, I do myself the venous Doppler, and most of the times, if required, we do standing in a standing position to find out even the hidden veins which only comes out when the patient is there in the standing position. So that is a Doppler test, and apart from this, most of the times these are the only tests which is required. Very rarely MRI and CT, but not.
So what are the treatment methods, sir? Actually, most of the people will be afraid because veins are the sensitive part in their body.
So as I said, there are 5 stages. So stage 1 and stage 2, most of the times, stage 1 definitely, most of the patients come with a cosmetic reason only, because they find these bluish veins, black veins, and looks little ugly on the skin. So they come in the cosmetic, and most of the times only medications, change in lifestyle, avoiding long standing, and stockings is more than sufficient.
Okay.
Even in the stage 2, if they are not, these veins are not very much swollen and all, we can manage them conservatively. Change in lifestyle, stockings, regular exercise and diet, these will help. But stage 3, when the patient's symptoms, already skin changes are there, pain is there, and stage 4 and stage 5 most of the times do require proper definitive treatment, like surgery or any other non-surgical treatment like laser and all. Because at this point veins have swollen so much that now it is very difficult to go back to their normal stage, because these veins are like a rubber, like elastic. So anything like this rubber and elastic, when initially they are tight, but when you do it stretch it regularly, at some point that rubber or elastic become loose and it cannot have that normal elasticity. So same is with the vein. So over a period of time, after so many years, these veins have lost their normal elasticity, and now it is very difficult, even after the conservative management with the stockings, exercise, diet, change in lifestyle, it is very difficult for those veins to become normal. So that point you need definitive treatment like surgery or laser. But definitely now no need to worry because of surgery, because surgery is nowadays no one is doing, is a completely outdated treatment. Now we have the non-surgical treatment, so patient need not to worry about that. It's a simple same how people or patients, they take saline through the IV line, it will be same hole through the in the leg, and through that we send the laser fiber, identify all those veins. Similarly, how we do the test, the Doppler test, even while doing the laser treatment, we see those veins under Doppler test and try to identify each vein and treat with the same hole. The laser fiber, it will be a same pinpoint, like a tip will be there, small, similar to our injection kind of thing. So we send them and cure all those veins and come out. It is a daycare procedure. We do it under anesthesia, local anesthesia, and very safe, without any risk complications. There is no blood loss. Patient can go back home on the same day by walk, and 1 or 2 days rest and then back to work. So patient need not to worry about what will happen, whether the risk complication surgery or anesthesia, major anesthesia like we do under local anesthesia. So it's very simple, safe treatment nowadays for the advanced varicose veins.
Will all the abnormal veins will be treated at one penetration?
Yeah. See, because these veins are not separate. All these veins are connected to each other. So we can reach through the same hole to all these veins. So you need not to puncture at multiple places. You need not to cut here and take the stitches like in the surgery and all. So there will not be any blood loss, nothing. So it will be like saline only. If you give from your hand, even the disease there in the liver, the medicine will reach in the liver. So in the legs also, these veins are all connected. So you, through the single hole, you can treat all those veins.
So how many sittings will be there in this treatment?
No, there is no setting. A one-time treatment. It has 98% success rate. So if you do it meticulously, that's the reason it is very important to go and get treated at a specialist like vascular intervention radiologist or vascular surgeon or vascular physician, because sometimes if they don't do it completely or not treated properly, then you can have recurrence. And that's the reason some of the patients, when they come to me, they ask, sir, I heard from few of my known patients, even after doing the laser treatment or surgery, they have now recurrence. So sometimes if some general surgeons or someone who is just a trained person for few more years, or they have gone for training for short period like 3 months short course and all, and they are doing, so definitely that's the reason we are not finding a uniform results in the outside. So it's very important to get it done from an expert rather than just for finding a general surgeon or someone who is trained for a few months and all and doing it for a low cost.
So to avoid reoccurrence, what are the precautions to be taken?
One thing very important, even after laser treatment, the patient has to use the stockings. Change in lifestyle is very important. If the patient is obese and all, weight reduction, because when you are obese, the tummy is fat and body weights, this puts on your legs, the lower half of the body.
Okay.
That's the reason the veins won't be able to work at a normal pace. So weight reduction, regular walking, and I said muscle pump. Legs muscle, calf muscles are the peripheral heart. They
Okay.
pump the blood. So you need to regularly walk. You need to strengthen those calf muscles. So those are all very important. Change in diet. Um, change in diet because anything which makes blood thick
Okay.
will aggravate your symptoms. So blood has to be properly thin. It should circulate, improve the circulation. So those are all important even after the laser treatment
Okay.
to prevent the recurrence of the disease.